Hello, everybody, and welcome back to episode 4 of I Don't Care with Alexia DeStefano. I'm so excited because today I have someone who I've looked up to for quite a while since I've met you, honestly, Christina, who is a medical esthetician. So, do you want to just talk about yourself for a second, introduce who you are and what a medical esthetician even is?
Sure. Hello, I'm Christina.
Hi.
I am a medical esthetician and phlebotomist, actually.
Yes.
And so a medical esthetician is somebody that deals with people's skin. So in an aesthetic sense, where I'm helping to really just create new healthy skin, but in a medical setting. So I work for a doctor, we work with nurses, we use medical grade lasers, devices, medical grade skincare. And then after I became a medical esthetician, I went to school to become a phlebotomist.
And what's that?
A phlebotomist is someone who draws blood. So
Mhm.
it really is just a fancy word of saying that I take people's blood.
Yeah.
So typically a phlebotomist is someone that would work in a hospital setting or like at Life Labs.
Yeah.
But I wanted to use it for medical aesthetic purposes. So I specifically use it for skin rejuvenation, scar treatments, and hair loss.
What about, is it IPL, which is the vampire facials?
No, IPL is intense pulse light. So that's a light therapy.
Oh, okay.
We do BBL at the
BBL.
clinic. Yes, which everyone knows as the Brazilian butt lift.
Mm.
But no, it's broadband light with
Okay.
us at the clinic. And then vampire facial is PRP.
PRP. I knew it was one of those
It's like,
letters.
yeah, it's the letters. Platelet-rich plasma.
Okay.
And then we do PRF for
Okay.
hair loss, which is platelet-rich fibrin. So there's a little bit of a
Ooh.
difference between the two there.
Okay.
Yeah.
So, because I'm wanting you to explain what a medical esthetician is, because every time I say medical esthetician to people, they're like, oh, like an esthetician?
Yeah.
And it's like, no, they're very different.
Yeah, we are very different. So an esthetician is someone that would work in a spa, for example. They
Mhm.
would do facials, they would do hair removal, waxing,
Yeah.
that sort
The
of
nails,
thing.
like,
Yeah, exactly.
Yeah.
So if you went to a spa, an esthetician would give you a facial.
Mhm.
They would maybe do some extractions of blackheads. They would do a lot of waxing, that sort of thing.
Yeah, because when I was talking to you about becoming a medical esthetician and people were asking like what you wanted to do, and I was like, become a medical esthetician, they're like, oh, certainly you could do better than become an esthetician. And I'm
Right.
like, well, first, estheticians are great jobs. You're having fun doing all the beauty stuff.
Yeah.
But I'm like, but it's not, it's like different. It's not the same thing. But also, I want to do whatever I want to do. But
Absolutely.
then I didn't end up going through with it at all.
Well,
so.
see, and I didn't want to become an esthetician because I wanted nothing to do with removing people's
Oh,
hair and waxing and spa grade facials. And
Yeah,
it
spa
just,
grade facials, that's not fun at all.
yeah, like to me, it's just, I don't really want to massage people's faces and sit around putting masks on and
Yeah.
waxing their bikini lines. Like, it's fantastic if that's
Yeah.
what you want to do. I know a lot of estheticians, they love what they do.
Yeah.
But it just wasn't what I wanted to
Mhm.
do. And I had worked in skincare and makeup for so long that I knew I wanted to take it further, but
Mhm.
aesthetics wasn't the route I wanted to take. I wanted to be more medical.
Let's talk about that. How did
Okay.
you discover your love for makeup and skincare? Was it something that you always knew you liked?
Yeah, when I was in high school, I actually started working for the Body Shop. So I was
Oh.
15, and
Would you recommend stuff from the Body Shop?
I would not. Body, yes,
Mhm.
but skincare, no. Now I've learned a lot, and no.
Yeah.
I mean, neck down, sure.
Mhm.
Use all their body stuff, use all their fragrances. It's a
Yeah.
great company. They have a great moral code, which was really important to me as a
Yeah.
teenager. I was all about animal rights. I was all
Oh, yeah.
about, protecting the environment and cruelty free.
Yeah.
And the Body Shop was one of the only companies back then that were really forward thinking.
Mm.
And so that was one of my first jobs. And then I fell in love with skincare. Then I moved away years and years later to Grand Prairie, Alberta, of all places. And I went to a beauty boutique there, and I started running the beauty boutique.
Oh, nice.
Yeah, as an assistant manager. So that's when I really got into more of the cosmeceuticals, which is a higher end skincare line before you get to medical grade.
Okay.
So there's like Shoppers Drug Mart, Neutrogena, Oil of Olay. Then you get your cosmeceuticals, which are like your ordinary Drunk Elephant, La Roche-Posay, and then you get to medical grade.
Okay.
So I was trained in the cosmeceutical department to that point, changing people's skin. I truly was, but there was something missing, and I felt like I could do more. So I did some research, looked into how I could work for a doctor, or knew nursing wasn't something I wanted to do. Didn't want to go to school for 4 years for skin. And found medical esthetician. So I left Alberta, moved to Vancouver, and 8 years later, here we are.
That's my next question, actually, is how was it to move to go to school? Because you moved straight next door, right?
Yeah.
Which, by the way, I forgot to mention, Christina was my neighbor, but they recently moved. But yeah, you moved right away with your husband, but you didn't even know he was going to be your husband.
Yeah, it's an insane story. I was in Alberta and decided I wanted to become a medical esthetician. So I went on Craigslist, actually, looking for a roommate. And this house was literally like a 10-minute bus ride away from the school. So I thought, how perfect is this?
Just the one bus, the 188.
The 188 taking me to my school. And it just so happened that the room in the house was being rented by a guy who was going through a divorce, and he, had a lot of bills to pay. He just purchased a company, there were some financial things that had come up, and he needed a roommate. And well, one thing led to another, and he now 8 years later is my husband. We have 2 kids together. So I went to school, and I became a medical esthetician, but I also became a wife and a mother in that time frame as well.
Okay, we're gonna jump, because I do have that as a question too, but it was gonna be for later on, but we're here now. So that jump, because going from someone who is, just dating someone, whatever, single, it doesn't matter your dating status, but alone essentially, to then having 1 kid and working, to then having 2 kids and working. Was that like struggling? Was it hard emotionally, or like, how was that process?
I actually never really wanted to become a mom. I was very career driven. I was very career focused. I wanted to climb the career ladder. I wanted to get as far as I could in my career. There are limitations being a medical esthetician, limitations being a phlebotomist when you don't have your nursing, when you aren't a physician. Obviously, there's only so much you can do. As you can only take it so far. I really wanted to take it as far as I possibly could. And I thought that motherhood would prevent me from getting there. And I worked really long days. Like I would work usually 10-hour days with the doctors, and I worked for 2 when I started in the industry. And motherhood was not something that was on my radar at all. And then on our 1-year anniversary, I got pregnant, and it was a huge shock for sure, trying to figure out how I was going to balance my career and how I was going to be a mom. And I figured it out.
You can tell that you figured it out. I feel like pretty and error. Quickly, it seems from the outside at least, that you're like, oh, I got the hang of it. But
I do.
You are. I mean, I am like you in the sense of career driven. I don't want kids. I'm all like, my career is number 1 to me. And so just the thought of having kids, I'm like, oh, no, thank you.
That was me.
That was you.
But you can have both. You can. And I've learned that. I thought really, having children and becoming a mom meant that I had to give up my career, or I had to give up who I was. My mom was a stay-at-home mom.
Mine too.
Her life was devoted to her children, and that was what I thought I would end up like. And not that it's a bad thing to be a stay-at-home mom or to give up your career to be a mother. I mean, my mom was literally put on this planet to be a mom. And she was the best mom that you could ever ask for. But that was also a very high bar to live up to, and I knew I never would. I will never be my mom. I will never be that person who gives 100% of themselves for their children. My children are my everything, but they are not my only thing.
Right. Yeah.
And so that was really tough in the beginning, trying to navigate being a good mom and being a good career person and having people understand that, yes, you can have both.
Yeah, I think a lot of people don't too. Because just because I don't want kids doesn't mean I don't see the balance between the two. I think that when there's a mom who works and is a great mom, it's just showing their kids that you can do everything.
Absolutely.
And you can be all versions of who you want to be.
Yeah.
So I think it's good.
Yeah, and you know what? My biggest piece of advice would be really focus on yourself. And then once you figure that out, you'll probably know if you want to be a mom or not. It's not for everybody.
Yeah.
You know?
I mean, from what I've gathered, I really don't want to be a mom. I think
you have tons of time to figure out if you want that or not. And you might be one of those women who solely focuses on their career and then you end up 36, 37, 38 having your first kid.
I want to be like J-Lo.
It's normal now to be that. I was a very young mom and I was not ready for it and I was not prepared for it. Do I regret it? Absolutely not. Right. My girls are the best things that ever happened to me.
They're awesome.
But it was a big learning curve for sure.
So when you were graduating, you graduated top of your class, which is great.
Yeah.
I'd like to think I graduated top of my class too, but nobody told me. Were you nervous about getting work, or were you like, no, I've got this in the bag?
No, I was super nervous. It's a very tough industry to get into. They don't tell you that in school. They obviously tell you that it's a very open industry, and it is. I mean, especially now compared to when I got into the industry, there's a clinic on every corner at this point. They're everywhere. It's very, very common now to get Botox, to do dermal fillers, to take care of your skin. Back then, it was just sort of becoming mainstream.
Back then being
8 years ago.
Okay.
Yeah, which is actually a long time in this industry.
Because that's really not a long time.
No, it really isn't. But people were still very scared to come out to say they did Botox. 18-year-olds weren't getting their lips filled. People didn't know what medical grade skincare was. It was a very, very different industry 8 years ago than it is now.
People still don't know what medical skincare is.
That's true.
Do you want to explain what it is?
That's true. So medical grade skincare is skincare that has been formulated for physician or medical grade use only. So it is a clinically proven skincare brand that has white paper clinical studies to back it. So in order to get a white paper clinical study, there are certain steps you have to take to be able to obtain those white papers.
Right.
And so it's a very rigorous clinical procedure, and it costs a lot of money to do these sorts of things. So a cosmeceutical, like I had mentioned earlier, for example, something that you can buy at Sephora, they do not have the same criteria. They don't take the same steps to prove that their individual ingredients and their individual products have been, taken by these pharmaceutical companies or these labs or these scientists, these doctors. They take the ingredient and they go, oh, we use retinol.
Right.
Well, that's fantastic.
Yeah.
But what does your retinol do? Is your retinol clinically proven to work within the layers of the skin?
Right.
Is your product such a fine particle, such a small molecular weight that it actually can penetrate into the tissue, doing what it needs to do?
Yeah.
No, it can't.
Yeah.
So their money goes to marketing. Their money goes to pretty packaging, to ads, to advertising. Whereas all the money in medical grade skincare goes to the product.
Yeah.
Goes to the trials and the science.
And when you use both versions of the products, right, you can see how good the medical grade stuff is. I mean, there's no comparison, really.
No, the other week I had a consult with a patient, and this happens all the time, where they feel like they're on really good skincare and they come in feeling really good about their skincare regime, and they're telling me, oh, you know, I use Paula's Choice and I use the ordinary niacinamide, and they're throwing out all these fancy terms. And I'm like, well, that's great and all, but if you were really happy with your skin, you wouldn't be sitting in my chair, right? And so then I educate them on the difference between what they're using and what I have to offer. And they'll say, oh, well, I'm on a 3% retinol. I'm like, well, no, you're not. Because I could put you on a 1% prescription grade retinoic acid and it would literally blow your face off. So you're not on 1% retinol. And a couple weeks into this regime, I put her on, she messaged me and she was like, yeah, you weren't kidding. My face is literally falling off. And it just goes to show that whatever she thought she was doing and those percentages she was using really did not equal to what I could do for her with medical grade skincare.
Even for me, both the 0.25% and then the 0.5%, my face didn't react at all. But then you saw, because I put it on my neck and I didn't know I was supposed to. My neck had a rash and
neck doesn't like retinol.
No. Last night I was so tired. I was doing my retinol and then I did put it on my neck and I was like, oh shit. But I left it. I just put my cream on, but nothing's happening.
One night won't kill you. But yeah, I'll do a few nights in a row and then I literally look like I've had an eczema breakout on my neck, and then I come off of it for a week, and then I'll do it one day here, one day there. You want to give your neck a little bit of retinol, but typically what you put on your face, you wouldn't put on your neck as far as retinol goes. Other things, it doesn't matter. But
yeah, because I remember when I was rashing out, people were looking at me and were like, and you're recommending these products? And I'm like, yes, 100%. Guys, I used it wrong. Don't look at me. This wasn't, don't use it here.
And that's what a lot of people's face will look like, actually. You had a great reaction to retinol. You have a thicker skin. You're more prone to oil. You have larger pores. Those are all things that will benefit you in the long run, too. You'll age at a slower rate. You'll have less wrinkles. The problem with that kind of skin when you're younger is acne, oil control, blackheads, but that skin always does better with retinol because it's more tolerant. So a lot of people will actually look like hell when they're trying to retinize because their face is literally shedding, peeling, red, itchy, burning, falling off. But that is a short window, a short period of time, and then the skin eventually does learn how to tolerate it.
I was really hoping that I would get the purge. I was like, I want to see this. Even my mom didn't, but she's not. She's still on.
She's on a low dose.
Yeah, and she's with the other brand,
Skin Medica.
So.
Very different way of retinizing.
Yeah. And so one day when she gets onto Zeo and the higher doses, I want her skin to purge because she's got drier skin too than me. But yeah, I luckily never had acne. I'll get like some really big zits here and there, but I do get congested. That's always on my forehead.
Me too.
That's the most annoying because I'm like, what am I doing? That's my thing, because I'll have really nice skin and then one day it's just boom, a bump, and I'm like, oh, it's the worst.
That's that oil.
And so even with sunscreens, it always makes me look like a grease ball, which I don't mind because I'll just powder if I need to. As long as I'm wearing my sunscreen, I don't really care. But I'm just like, oh, why does it have to look like that? Also, I'm using the Elastin sunscreen that I'm pretty sure isn't certified or whatever in Canada.
How did you get the Elastin sunscreen?
I found it on Marketplace for really cheap. And this girl was selling, hold on, let me show you. So this woman said it was her birthday and that her friend bought her Elastin products, but she didn't want to use them because she has her own routine. So I was like, I'll buy them. She's like, okay, how much? And I was like, $30 for everything. These two products and the sunscreen. Knowing that this product alone is expensive, like over what, 200 or something?
Well, this is very interesting because this is a back bar size. So this is something that wouldn't even be available to the public. So someone has done something very, very naughty because in my industry, you are not allowed to sell back bar skincare to people that are not patients.
I'm pretty sure it literally says somewhere, do not sell.
Oh yeah, for sure. This is a back bar size of the restorative skin complex. So you cannot purchase this if you are not a medical esthetician using it for back bar purposes in clinic.
Well, here
this
I am.
gentle cleanser, yes, that you can retail. And then the Elastin sunscreen, yeah, is not available in Canada.
I'm pretty sure that one says do not resale on it. The little sticker on the back, and I just look at that and I'm like, ha, but I got it. For $30 I got these products.
That's insane.
And they're all
especially
sealed
since this restorative alone would be about $300.
I know, because I was looking on the website before I bought it because I wanted to make sure that it was, you know, legit or whatever. And I only saw the smaller size, and I was like, well, this size is smaller and so expensive, so I can only imagine what this price is.
Yep, someone in the industry obviously got some complimentary skincare and then gave it to a friend, and the friend sold it.
Yeah.
So
and the friend could have made so much money.
So much more money. $30 for 3 Elastin products.
As soon as I saw it, I couldn't pass it.
Oh God, no! But if that girl gets caught, she'll probably get let go from her clinic. So that's a big no-no.
That's some tea over here. I didn't know.
But you're benefiting, so
I did. I benefit so much. As soon as I saw it, I was like, "Holy shit!" And I went around telling everyone. I was like, "This girl on Marketplace is selling all these products. She doesn't even know the worth of them. And here I am. And I'm gonna scoop them all up."
Yeah, this is some of the best skincare in the industry.
Wow.
That you got your hands on.
Yeah, this I don't use often. I just use a couple nights because I don't want to waste it. Because I'm like, as soon as it's gone, I won't be purchasing
this is
again.
the liquid gold of the Elastin skincare line, the restorative skin complex. So that's your trihex technology, which is really essentially your peptide complex triggering your growth factor, your fibroblast cell to create new growth factors, collagen and elastin. This is super anti-aging. And there's a plumping and firming technology in that one too. So fine lines, wrinkles, all of the good stuff. Yeah, that one is... That's the baby.
Yeah.
Take good care of that one.
Oh, I will. Okay, this is kind of a broad question, but I feel like you might, I don't know, maybe talking about sunscreen, you might go somewhere with that or somewhere else, but what is something about skincare that you want people to know?
Yeah, sunscreen is a big one.
Yeah.
Sunscreen's huge. So whenever I see someone in consult who either looks incredibly good for their age or who has extremely poor skin quality.
Right.
Genetics play a huge role, but typically it's their sun protection and their use of sunscreen. I had a consult with a 52-year-old woman yesterday, and she looked phenomenal. Her skin was in such incredible shape. And I asked her, I said, you know, do you avoid the sun? And she said, oh yeah, I break out in heat rashes.
Ooh.
I don't do well in the sun, so I've always avoided it my entire life. She said even back in the day when no one wore sunscreen, there I was in a hat under an umbrella protecting my skin with sunscreen. And it truly showed. She had the skin of a 30-year-old woman.
Wow.
She looked incredible. And then, you know, a couple weeks prior, I had a consult with a woman who I thought was probably in her early 60s, and she was in her late 40s.
Wow. Oh
and
my
her
God,
skin was
so scary.
Oh, it was in such horrible condition. And she loved the sun. And so she was there for sun damage, but she had a home in Palm Springs that she lived in 6 months out of the year. She was retired. She'd done really well. She was in real estate. She retired early and now lives 6 months of the year in Palm Springs, 6 months of the year here.
Nice.
But yeah, her skin was weathered. It was not in good condition. And so I can get your skin a lot of life back. I can easily take a decade off of that damaged skin. But if you're going to keep going out in the sun, you're going to keep, you know, not protecting it, then there isn't much point.
Yeah.
So sunscreen would be probably the most important, and retinol. Retinol is the other thing that I tell everybody, unless you're pregnant or breastfeeding, retinol for life. Hugely anti-aging.
Oh no, as soon as I tell people that I use medical grade retinol, they look at me like I'm crazy. They're like, you're 19. I'm like, okay, and one day I'm gonna start aging, And that day will be longer, like way more in the future because I'm using retinol and sunscreen.
You'll look far younger than your girlfriends, I can tell you that much.
I always say that too. They're like, I don't need sunscreen, or I don't want to. I want to age naturally. And I'm like, okay, go ahead, but
there's
I'm going to
also
look
skin
hot.
cancer. So, I mean,
yes.
you know, it's more than just anti-aging.
I say that too. Oh, yeah, because one of my best friends, she is a person of color, so she's like, yeah, my melanin will protect me. And I'm like, no, not from cancer, certainly.
No, from a burn, sure.
Yeah.
Less risk of developing, you know, a melanoma most likely than someone who is white and doesn't have the same amount of melanin in their skin. But no, you are still very much at risk of developing skin cancer and also aging at a more rapid rate. So I try and educate my patients all the time. Anti-aging and skin cancer protection, huge. Just put your sunscreen on.
Yeah.
I tell them, you brush your teeth in the morning, put your sunscreen on.
Exactly.
It's as easy as that. Yeah. Even if I'm sitting in my home on a Saturday on a cloudy day and I'm not leaving, I brush my teeth, I put on my sunscreen.
Always. I even have alarms throughout the day to remind me to put my sunscreen on to
That's
reapply
fantastic.
it because I'll forget, not just because I'll be busy doing stuff, and so to remind myself I have my alarms.
I'm only that good on sunny days, but on normal days like today, for example, I wouldn't reapply. It's not necessary, but on sunny days, reapply for sure.
Yeah, I usually, when it's days like this or when I'm feeling lazy, I'll just reapply once.
Yeah.
And that's kind of it. Also, because I'm like, I don't want to reapply all the time too, because then I'm just out of product sooner and then I have to buy it again.
Only reapply on the sunny days.
Taking a step back to the sun, can you explain why it's dangerous, other than obviously we talked about cancer and hyperpigmentation and that stuff, but why else should people stay out of it? Just I really want to emphasize sun safety.
Well, I feel like if you're worried about aging, if you're worried about the health of your skin and keeping your skin as healthy as possible, the sun is the number one destroyer of our skin.
Yeah.
So what happens is you have UVA and you have UVB rays. The UVA are the aging, the UVB are the burning.
Yeah.
So a lot of times patients will tell me that they just use sunscreen in the summer months because they're worried about the UVB, the burning rays. Yeah. But the UV rays, the UVA rays, the aging rays, they're always present. Whether the sun is out, whether it's a cloudy day.
Yeah.
Those rays are always constantly penetrating. They penetrate through glass.
Yeah.
We now know that blue light breaks down our collagen and elastin. So that's the light from our lighting in our homes, our offices, our computers, our phones. We now know that all of those things age us too.
Yeah.
So our sunscreens are formulated to literally act as a shield to protect our skin from breaking down, degrading, keeps our skin as healthy and as protected as possible. So if you're not even, you know, if cancer isn't even on your radar,
which should be.
It should be, but I mean, a lot of girls, especially 19, 20, 25, they don't care.
Yeah.
But they do care about getting old. That is something in my profession that I see constantly. Young girls, especially nowadays, are terrified of a wrinkle. They're terrified of getting old. Yeah. So I tell them, well, then the best thing that you could possibly do is put your damn sunscreen on and throw some retinol on at night. Yeah. Those are the two most important things. So from an anti-aging perspective alone, sunscreen is everything. Yeah. It is everything. And all of our medical grade sunscreens are moisturizers too. Yeah. So a lot of people feel like, oh my God, I have to put a moisturizer on and then I have to throw like a heavy, goopy, white sunscreen on. And medical sunscreens are not formulated that way. It's your antioxidant, it's your moisturizer, and it's your sunscreen in one. Yeah. Super lightweight. Like you mentioned before, they might go on white, but they blend in, or just grab a tinted one. Yeah, exactly. That's my foundation. I just wear tinted sunscreen.
Yeah, when I use tinted sunscreen too, I mean, I never use foundation anyways, but I just look so gorgeous with that tinted sunscreen. Yeah. Yes. Any little imperfection that you might have, gone, I
Yep.
feel.
And
Love
that's
it.
another thing too with treatments. If you're trying to improve those imperfections,
Yeah.
you can't have an active tan.
Right.
So a lot of times in the summer months, the clinic slows down as far as the BBL is concerned, the lasers are concerned, because so many people are developing tans and then they can't do treatment.
Do people come in with tans and then you guys notice it and are like, we can't do it for you?
And we'll tell them they have to go and we'll have to reschedule them, which sucks for both parties. I mean, we book months out at our clinic, and so getting those appointments are not easy.
Yeah.
And then when we finally get you in to be turned away, you know, it wastes our time.
Right.
And it, you know, now the patient has to wait until the tan is gone, and then they have to wait until there's an opening.
Right.
So on both ends, it's not ideal. And we educate, do not get a tan. Wear your sunscreen, protect your face. And yeah, I will turn you away if you come in with a tan, because you'll end up with a nasty burn. And I don't need that, and neither do you.
Yeah, exactly. I was getting my makeup done for something, and the makeup artist looks at me to see what concealer and foundation to use, and she goes, "Oh, you have gorgeous skin, but I can just tell that it's screaming to get darker. Like, your skin is screaming for a tan." And I'm like, well, she can keep screaming, but this sunscreen, she's like, I know, but don't you ever just want to give your skin like what it wants? And I'm like, I am, with sunscreen.
Wow.
Yeah, it was, the makeup artist and the photographer both don't really believe in sunscreen, and I was like, that's fine, you guys do you, but I'm gonna wear my sunscreen. And they did keep saying you have gorgeous skin, and I'm like,
there's a reason for that.
Yeah.
If you want color, go get a spray tan or throw on, you know, a self tanner. But no, the sun is, and that's the thing, you shouldn't need pounds of makeup to cover up your imperfections if you can just treat your imperfections with skincare. That's one thing that I always tell my patients. They'll say, oh, what makeup do you use? I don't wear makeup. I wear tinted sunscreen, throw on some bronzer if I'm really tired, concealer under my eyes, and off I go. But if you're having to put so much makeup on to cover your skin, then go back to the source of the problem, which is your skin. Treat that, and then you won't need all of the makeup.
Yeah, and it's such a difference, like, good skin with no makeup versus, you know, troubled skin.
Well, even good skin with makeup.
I know.
You know, like,
as soon as I put concealer on, I'm like, ooh, I don't like this.
Yeah, it feels heavy. It feels weighed down. But what, you know, a lot of my makeup artists now finally realize too, if their skin is in great condition, then their makeup looks so much better. So that's one thing too. If you want to wear makeup, go ahead, try and, you know, use good quality makeup. Try and find a mineral when possible so the skin can breathe. It's not being weighed down by all that gunk. But if your skin looks good, your makeup is going to look so much better. So get to the source of the problem, fix that, and then your makeup, if you want to wear it, will look far better than if you are suffering from poor skin.
And it helps with confidence too.
Oh, totally. When you look good, you feel good.
Yeah, exactly. And when you feel good leaving your house without any makeup on, like, that is, that's just, oh, I love it. Because I only wear makeup for work, because on camera you kind of want to. But other than that, I just have one drawer. I have 4 drawers of skincare, and then the one top drawer is makeup, and I barely touch it. And
I have a slew of makeup, and I probably put it on once every few months when my husband and I are going out for dinner, or if I, you know, I used to wear it a lot more because we'd go to conferences, and you know, I would be on camera a lot more, and then COVID hit and we were in masks, so it's like, what's the point?
Yeah, exactly.
But now that we're not masked, I'm still not wearing nearly as much makeup, because there's not much point putting it on if you don't need it.
I only do my eyebrows because
I always do my brows.
thin.
Today I didn't, but I always do my brows.
I usually, like, when I go to the dog park and stuff, I'm like, why the heck would I do it? But today I was like, no, let me get a little put together and put these brows on.
A little bronzer, a little mascara, a little brow, a little gloss is all you need, and then let the skin shine.
People are always telling me when I say I did a full glam for myself, they're like, I can't even see it. Like, you're wearing makeup right now? And I'm like, Yeah, well, I mean, I blend.
Yes.
I like to make sure that there's no lines or anything.
Yeah.
Because you see certain people sometimes and you're like, ooh, I do not want that makeup on me.
Yes.
So I make sure I blend everything.
Always important.
We're going to play a little game. It's called Crap or Fact, or technically Fact or Crap.
Okay.
Crap or Fat?
What?
I'm struggling right now. I wrote it down as crap or fact. So
this sounds terrifying.
It's pretty much just I'm going to say a statement,
yeah.
and you say if it's true or crap.
Okay, so this is like a true or false.
Yeah.
Okay.
And then you could explain if you want. So, the first. Essential oils are better than chemicals.
I don't even know what that means.
Essential oils in products. So, an all-natural product made from essential oils is better than products made with scientific chemicals, all of that in it.
Got it. Okay. Well, that would be false. Crap. Yeah. Essential oils are fantastic. I diffuse them in my house all the time. You can put them in your bath. You can throw them in your hair. Put them all over your body in a cream. But oils are not good for the skin. Now, a lot of people will tell me that that is incorrect, but from a medical grade perspective, we know that oils are inflammatory to our skin. So Zaino Baji, the dermatologist who founded and owns Zeo, which is a medical grade company that we use, he was really the pioneer in medical grade skincare, and through all of his clinical studies and all of his science, he has found that oil leads to inflammation. So we come from a perspective that oil is the enemy. Reduce oil, increase hydration. Essential oils are not going to necessarily harm your skin, but they're not going to help. So a lot of patients will say, oh, I use coconut oil. Oh, that's just nothing but inflammation and clogging.
Oh, I know. I did a trend where I only used coconut oil.
Put it all over your body and your hair, but keep it away from your face. The skin on your face is so thin that it requires certain ingredients, and it cannot take in such an occlusive product like coconut oil. I really, like, rosehip oil is fine to remove your makeup as long as you're cleansing it off. You can put, like, there's a lot of almond oil in medical grade skincare, jojoba oil. There are certain oils that are blended in to act as calming agents. But when patients are just putting essential oils or pure oils on their face, it's a big no. No.
Okay. Preservatives, so parabens, in skincare are bad.
Oh, that's a tough one. I say no, because a lot of medical grade skincare is formulated with some preservatives and parabens just to keep the product active to you know, increase their shelf life. There's a lot of literature to support that they are bad, but there is nothing that has been clinically proven to show that they are creating these so-called cancers and whatnot in our bodies. No one has actually come out and physically been able to prove that putting a paraben or a preservative on your face absolutely leads to skin cancer. It's not proven.
But the sun absolutely leads to skin cancer.
That we 100% know. Yeah. I was driving home last night from picking up my daughter from her Taekwondo camp, and the sun was out on the left side of my face. I didn't have my hat because I had just come from work. And I had the visor, and I was doing all these things, and I could literally feel my face melting off. And I'm looking like a nut job driving down the highway trying to, like, duck out of the sun. People probably thought there was a bug in my car. And I'm doing everything I can because I'm like, oh my God, I can feel my face burning.
Oh, it's the worst feeling.
Yes. And really so when you're on good skincare, you don't want to be in the sun because it doesn't feel good.
No.
You're trying to find the shade.
Even at the dog park, if I feel, because I bring the sunscreen with me, obviously, if I feel even on my body a little burn, that's it. I'm reapplying and I'm already in the shade, but I find a better part of the shade. And everybody looks at me like I'm crazy, and I'm like, good skin, guys. This is what you gotta do for good skin.
Absolutely.
They're like, you are 19, and I'm like, I do not care if I'm young. This is
No.
when you start.
Absolutely. It's
Yeah.
all about prevention. Everything I preach is prevention.
Yeah.
So you're doing a great job.
Thank you. Okay. Homemade products are better than... homemade products are more trustworthy.
No.
Yeah.
Definitely not. You
Yeah.
have no idea what you're putting into your homemade product. You think you do.
Mm-hmm.
You know, you've got your coconut oil and you've got your almond oil and
Your
then
sugar.
you've got, yeah,
Yeah,
you know, and
all
you're
of that.
blending it all together and then you're slapping it on. But what's it doing for you? You don't really know. There's no science behind it. Nothing is clinically proven.
Yeah.
No, definitely not. Put it, like I said, put it on your body. Make your own body butters and do what you got to do. Make your own bath bombs and throw some Epsom salts and oils in there, sure, but the skin on your face needs something else. It needs something more.
Okay, this is another little game, and it's called What Would You Do? So pretty much I'm just going to say something that maybe a patient would come in with, and then you would say how you would treat it or what you would do.
Okay.
So what treatment would you give someone who wants to reverse hyperpigmentation, so sun damage? Okay. Or just dark spots, period.
Yeah. So hyperpigmentation comes from an injury. So let's say you had an acne breakout, you picked it, you hyperpigment. Sun damage is different. That is just pigmentation that's been brought from the sun. So typically I would treat them in a very similar fashion. I start usually with BBL, broadband light. That light pulls the pigment out of the skin. So it either pulls the sun damaged lesion or it darkens the hyperpigmentation. And then the skin goes through a period of 5 to 7 days where it kind of crusts, sloughs off, looks like little coffee grinds on the skin, and then all the pigment lightens up. You typically do a series of 3 treatments, 5 if it's severe.
Yeah.
BBL can also treat active acne, so I'll do a combination of the two. I'll do the blue light for the bacteria, the sebaceous gland, and then I'll do the red light for the hyperpigmentation and the scarring. With sun damage, you don't do that because it's not necessary. You just focus on the red light, and you're just treating those layers of pigment. So that's how I would typically start. And then once that really, epidermal layer has been sloughed off, then we go into microneedling, or we'll go into halo. And halo is laser, erbium laser. So definitely one of the most aggressive forms of treating hyperpigmentation or sun damage, but the best.
Because I know
nothing works like halo.
One of the girls at the dog park went to a medical clinic to get rid of some sunspots and stuff, and I think she did, if I can't remember, I think she did, I don't remember what the treatment was. It was
IPL probably?
Maybe, I think it was IPL. Yeah. She did 3 treatments of it and nothing happened, so she stopped.
Okay.
And so I was like, well, I'm going to ask for you.
So that's a sign of melasma. So if you are doing IPL, which is intense pulse light, or BBL, which is broadband light, your pigment should be lifting and resurfacing. If you're not seeing any improvement and that pigment isn't budging, you most likely have a different skin disorder, which is melasma.
And lots of people get that during pregnancy, right?
Yeah, melasma is really common in pregnancy. It's triggered by a hormonal change in the body. So pregnancy is one. Photosensitizing medications, a long-term birth control can be one. And it's triggered by the sun. Okay. So the hormones trigger the melasma, and then the sun triggers the darkening of the melasma. So there's a very good possibility that she has that.
What would you do with a patient who does at-home microneedling?
I would be worried. I would be worried for them. Microneedling, people don't think that it's an invasive procedure, but it is.
It's little needles.
You're essentially puncturing and breaking the skin. At-home microneedling devices too are not medical grade devices. Yeah. God knows what those needles look like under a microscope.
And how do you clean them at home too? I'm sure people dunk them in alcohol.
I have no idea what they're doing with at-home devices. I've had a couple patients tell me that they microneedle at home. A lot of people dermal roll, so they'll have those little rollers with those 0.5 little needles still, not bacterial. It's a disaster for bacteria in the skin leading to infection. But microneedling is a whole other level because you can go up to 2.5 millimeters in the skin and do some serious damage. So we carry skin pen at the clinic. The skin pen, under a microscope, the needles are perfectly smooth. They're extremely sharp, which is very important as well, because if you have a dull needle and you're trying to ablate that skin, you're actually tearing and you're damaging the skin more so than initiating a healing response.
And I feel like you could see that on people who do at-home treatments.
Oh, yeah. Yeah. And I mean, 3 medical grade skin pen microneedling treatments, you should essentially have new skin. Whereas if you're doing it at home, I really don't think that you're going to get the same results.
Yeah.
And again, like I said, you're really increasing your risk of infection, bacteria entering the skin. Also, when you're introducing needles into the skin, you're creating puncture wounds. The skin is then open. What are you putting on your skin? Are you putting on There's a difference between a good skincare product, even medical grade, and injectable grade. Very, very different. So 99% of the medical grade skincare we have at the clinic cannot be applied immediately post microneedling.
So you give it little kits?
We'll give a take-home kit. Yeah. We have post microneedling kits that we'll give. Halo laser resurfacing, they get a whole slew of product after, because your risk of infection is so much higher.
Yeah.
Sunscreen can't be applied post microneedling. Really? So you would think, oh my God, my skin is this open wound.
Yeah.
I was bleeding. I'm red. I'm raw. I need to protect it. No, because sunscreen is not safe for 8 hours, even 12 hours following microneedling because of those open channels. Sunscreen should never be at that depth. So people would think probably at home, oh, I'm going to slap on my sunscreen.
Yeah.
You're actually doing more damage than good.
Yeah.
And I've seen in the industry, not us personally, but just people in the industry talking about doing treatments at home and how unsafe they are because they've seen some horrible infections. Things can really go wrong, and you don't think they can until it happens to you.
Yeah.
So don't treat yourself at home.
Yeah, do not do it.
Don't do it. It sounds like a good idea. It's not.
Just go spend the money.
Yeah, go to a professional.
Or don't do it at all.
Yeah, or save up your money if it's really important to you, and see a professional.
Yeah, I don't go on TikTok, but I know this is a huge thing.
I don't either, so I don't know. Yeah.
But we'll figure it out. So, do you know what Vaseline slugging is?
I've heard of this, but I don't. Okay. I've heard of slugging.
I took a screenshot of what people say it is.
Okay.
Slugging is a skincare trend which includes coating your face in petroleum or Vaseline. This is meant to prevent epidermal water loss and keep moisture in your skin. It's best for dry skin types. I'm wondering what your thoughts are about putting Vaseline and petroleum on your face.
Oh, for the love of God. Okay, so epidermal water loss is when you are not giving your skin the hydration that it needs. You're not just losing water in vast amounts, which would then mean that if you put a whole whack of Vaseline on your face, that all of a sudden now you are creating hydration or locking it in. And that's where I've seen the slugging trend, is with physicians and plastic surgeons and derms on Instagram being like, please stop slugging. This is not working for you. But I've never looked into what it is because I've not had anyone ask me, thankfully. You need to put medical grade hyaluronic acid into the skin. You need to put peptides, ceramides. You need to trigger your own ability to create hyaluronic acid. So like a lot of patients will tell me, oh, well, I'm on, hyaluronic acid. Well, if it's a cosmeceutical, what you're doing is you're putting hyaluronic acid on topically and it's going nowhere.
Right.
So then you could be suffering from epidermal water loss because you're not getting to that dermal layer and creating that hyaluronic acid. Medical grade skincare, you are. So if you're on the right skincare, you're always creating hydration. And like I said earlier, reducing oil, increasing hydration. But I mean, you're lucky if you're maybe getting a few layers into that epidermis. Lucky. You need to access that 10th layer. You need to be in that dermal layer. So like Elastin, we talked about earlier, what you got off Marketplace for free. They have a new HA Immerse, which is a clinically proven hyaluronic acid system that has such a fine molecular weight and such fine particles that is clinically proven to access all 10 layers of our skin.
Oh, wow.
And then in long-term use, it's actually upregulating our ability to create hyaluronic acid. So now are you not only hydrated, you're actually creating your own hydration.
That's impressive.
It's
that
phenomenal.
Products can do this for you.
I've been using it for the past couple months, and I've noticed a huge increase in my skin's hydration. And I'd like to point out too, with slugging, the only time that it would be safe or beneficial to do something like that would be a post-laser procedure. Okay. When the skin is raw, when you've removed either all of it or a portion of it, that's when you would be putting something like Petroleum or Vaseline on to protect the raw, open skin. Other than that, and you only do that for a day or two. Right. And then you get back to your medical grade skincare. Yeah. So other than that, no, please stop putting that on your face.
Because it's so viral right now, and it's all the videos I see, because I'll watch TikToks, but like on my Instagram, and even celebrities, they're like, I slug a few times a week, and I'm like, but for what? Yeah. Because they also think that it's locking in the products that they just put on. And it's like, well, where's it gonna go, though? Yeah. So I don't know.
If you're on good skincare, they're locked in. Yeah. That's what I don't understand. Yeah. Like, the product has penetrated into where it needs to be. It's not like your product has gone into the dermis and then it's back out. Jumping back out. Yeah. That makes absolutely no sense on any scientific level whatsoever. When the derms and the surgeons and the physicians start coming out and the scientists saying slugging is good, then we'll start slugging. But at this point, all I've seen is all of the experts saying, please stop doing what you're doing.
Exactly. And I just wanted to say that because I felt like you would be like, let's not do that.
Yeah, no.
Yeah. No. Okay, so one last thing that I want to bring up, and then we'll wrap it up here, is confidence, because you are someone who I feel just has a lot of it, whether you know it or not. You're always like, you just told yourself that, like, I know my worth.
All a lie.
No, I totally feel that. I feel that too. But it's like inspiring though, because that's how, you know, I want to be. I want to be like, yes, I know who I am, and I love who I am, and I'm working, and I'm getting there, and I'm pretty good at, for being 19, but it's, do you know that you're coming across to people with like a nice confidence? It's not cocky confidence.
Right. You know, fake it till you make it. I have had my struggles for sure in my life with, you know, body positivity, and there are lots of parts of me that I am not happy with that I would change if I could, but I try and walk around with my head held high. I try and exude self-confidence because I think it's really important to try and love yourself regardless of if there are things that you do or don't love about yourself. There are lots of things that I don't love about myself that I would change if I could, but there are lots of things about myself that I do love. Yeah. So I try and focus on those things. You can't see me right now, but I have my natural curls, and my 6-year-old is really struggling right now with her curls. Yeah.
Oh, I love her curls.
I know. She's got the most she looks like Shirley Temple. She's got the most beautiful curls, and there's a couple girls in cheerleading who are making fun of her hair, and she's struggling, and she's struggled with it for a while because people have always made fun of her short curls. And 99% of people will say how stunning she is and how much they love her hair, but it's that 1% that always sticks with you. You will always remember the negative comments. You will struggle to remember the good ones.
And it's awful. She's 6.
She's 6. Yeah. And she's already disliking her hair. So I'm going, okay, I don't like my curls. But to show her that it's okay to have curly hair, it's beautiful to have curly hair, I'm now wearing my hair curly. Because she said the other day, well, Mom, you have curly hair. Why do you straighten it? And I'm like, oh, no. We've come to that point. Yeah. You know what? I will still straighten my hair. I will still blow it out. And I've told her it's okay to do that when you get older. But it's about loving yourself regardless of what other people think. Yeah. And if you know me well, I was complaining about my thighs yesterday. I hate my dimples. I don't like this. I don't like that. But I think overall, you just have to be grateful for what you have.
Yeah.
Realize that it could be a whole hell of a lot worse.
Mhm.
Focus on the things that you do
Yeah.
like.
Yeah.
And just try and constantly, like, I do my Botox to
Yeah.
keep my skin wrinkle free.
Mhm.
I do fillers to keep my skin plump and to give
Yeah.
me the bone structure I want, to give me the definition that I don't
Mhm.
naturally have. A huge part of why I got into this industry was because I was insecure and I didn't have the confidence, because I wasn't blessed genetically like some of us
Ah.
with certain things that I
Mhm.
felt were important.
Right.
And so that really propelled me to get into this industry, to instill confidence
Yeah.
in other people. When you
Mhm.
look good, you feel good.
Yeah.
And it's really important, I think, for women especially to feel
Mhm.
good.
Yes.
And yeah, I've been told, that I'm intimidating and that I can come across as too much.
Yeah,
And I
sure.
take up a lot of space.
Yes.
I know I do. But I try and own it. And
Yeah.
I'm not for everyone.
Yeah.
And I know that.
Oh, I
You
am
have your
the same.
people.
Yeah.
And you know what? And that's what I told Scarlett last night when she was upset about these girls being mean to her at cheer. I
Mhm.
said, they're not your people.
Yeah.
And they're not worth your time.
Yeah.
They're not worth your energy.
Mhm.
Focus on those that do love you and
Yeah.
support you, and the rest is background noise.
Exactly. I agree.
Be a
all
queen.
of it. Exactly. Okay.
Oh.
I have one last question. I know I said the last one would be the last, but something you said made me think of it. And I'm going to read it exactly as it is or else I'm going to butcher it. What are your thoughts on people who think fillers and treatments are a form of botching yourself or becoming fake?
I think that the industry has really done a disservice on injectables.
Yeah.
I think that it can definitely go wrong. I think there's a lot of people out there with a needle in their hand that shouldn't
Absolutely
be injecting.
Mhm.
A lot of them are in this city.
Yeah.
People don't understand that not only can you look bad, but it actually can be really dangerous if it's not in the right hand. I pride myself on the fact that I feel like I work for one of the best injectors in the, country, let alone in the Lower Mainland. She's
Yeah.
phenomenal. She was just in Austria at a
Wow.
at a conference for
wow.
only a specific few chosen physicians.
Yeah.
She's extremely good at what she does,
Mhm.
but more importantly, she's safe.
Yeah.
And so there's a lot of misconception now that fillers make you look overdone, they make you look weird, they distort your face. They don't unless you're being over injected, you're being overfilled.
Yeah.
So I love them. I think fillers are here to
Mhm.
stay. They're not going anywhere. I think that they do so much for our face when they're in the right hand. Love me some Botox.
Yeah.
There is nothing Botox, Xeomin, Dysport, they're all neuromodulators. They're just different forms.
Yeah.
They all do the same thing essentially. Nothing can compare. And a lot of times in consult, patients will say, oh, there's just something about putting a toxin into my body that makes me feel uncomfortable. There are over 600 medical indications for Botox. You can put it into babies. You can put it into children with lazy eyes and spasming of the eye. That's how Botox became cosmetic. It was always a medical drug, and it became a cosmetic drug because they just found out, oh, well, it also works on wrinkles.
Well,
there's lots of safety there.
Yeah, if I wasn't an actor and needed full mobility of my face, I would 100% get Botox for my migraines.
Yeah.
But it's just
It's very therapeutic.
Yeah, I need these little forehead lines when I react. But one day I will get the Botox.
We do have a lot of actresses at the clinic. I have quite a famous actress as a patient. I can't say who, but
Can you tell me after? I'm kidding.
No. She's phenomenal and I just love her. And she has full expression, but she does Botox.
Okay.
You can do what's called microdosing, whereas you just reduce the movement, you reduce the depth of the wrinkle, but you still have the ability to use your muscle.
Okay.
And then there's full clinical dosing where you remove the ability to use that muscle entirely. So we have a lot of actresses and actors at the clinic who do injectables, but they just do less.
Okay.
They don't do a full clinical dose.
Good to know because these migraines, I tell you.
Yep.
Okay, last thing. Is there anything that you want to plug or anything you want to say? Shout out to the clinic. Anything? Any last words?
We'll always shout out to Beauty 2.0.
Yeah.
Shout out to Dr. Finding and her husband Mal.
Yes.
They are two of the best people on this planet, and I wouldn't be where I am without doctor-finding, especially.
Right.
You know, taking me under her wing and giving me all that she's given me. So I have to thank her greatly for that. I'm very, very blessed to be where I am in this industry, and loving what I do every single day.
Yeah, that's important.
It's huge. You know, waking up every day and loving what you do is so important.
Yeah.
And just, again, I want to reiterate safety. You know, as much as I love skin, and skin is what I do, I don't do injectables. That's for her and the doctors and the nurses. But yeah, there's a lot that can go wrong. Do your research.
Yeah.
If a clinic can get you in tomorrow, there's a reason for why they can get you in tomorrow. Right. People don't want to wait 6 months to get in. They don't want to wait 3 months to get in. But there's a reason why you're waiting to see our injectors. Yeah. They are good. Yeah. They are well trained, they are highly skilled, and they're safe. So yeah, the biggest takeaway would be find a good injector. Yeah. If it's not us, that's fine, but go somewhere reputable. And for the love of God, stop spending your money on crappy skincare. Yeah. Please.
Just spend it on the good stuff.
Educate yourself.
Yeah.
Yes.
Yeah, that's huge. Educating yourself and knowing what you're putting on your skin and what things actually are. Because you can use what works great for your friend, but it's awful for your skin.
We're all different. Yeah. And by the time you end up spending hundreds of dollars on different skincare products from the drugstore, Sephora, or, you know, the Bay, you would have spent half of that on quality skincare that would have actually changed your skin and healed it.
Yeah, exactly. Well, thank you for coming on.
Thanks
I had a
for
blast.
having me.
I love talking about skincare.
You know I do, so I'm always game.
I'm lucky to know you. Anytime I say I know a medical esthetician personally, people are like, oh, look at you. And I'm like, I know.
I'll keep you young forever.
Yes, thank you.